The Shawnee County Health Officer is the highest public health medical authority and has the responsibility and duty to monitor the distribution of disease, particularly infectious disease. All the state laws and codes were created when infectious disease was really the big concern for everybody. But over the years, that has expanded also beyond infectious disease. But a lot of what we do is really focused on infectious disease. So just monitor the distribution of disease, make sure that there are no unusual occurrences of disease, and take whatever action is necessary to contain the spread and the increasing number of cases of disease. When there is an outbreak, which means there is an unusual number of cases of any one disease, more than expected, then the health officer has, again, the general duty to contain the outbreak. And he or she needs to do anything necessary to avoid the spread of that particular outbreak. That includes restriction in the movement of people, both people who are infected and sick, and that's called isolation, and also people who have been exposed to people who are infected. So they may have been infected themselves, they still don't show symptoms, but they may be put in quarantine, which means they need to isolate themselves for a little while to make sure that they do not become infectious themselves. If things really get bad, the health officer could also have the power to cancel public gatherings or put some restrictions on public gatherings, and even a whole part of town or a whole town in quarantine if necessary. Now, we're really thinking of, we are talking of very extreme cases there, and hopefully that will never be necessary in our times. But again, these laws were set up when smallpox was still pretty young in people's memories, and the idea that there would be a need perhaps to put an entire neighborhood or town on some restrictive movement order, that's the kind of authority they gave to the health officer.